So in the second section of our topic, esophageal injury and infection, we'll be studying about the different type of surgical trauma. Surgical trauma being more confined to different types of tubes that are being used during surgery that can cause esophageal injury. The different types of esophageal tubes that are being used are the use of nasogastric tube, as nasogastric tube is being passed on when a patient is undergoing very major surgery. Nasogastric tube is being used, and other than that there are different types of non-endoscopic tubes which are more of a respiratory devices that are being used and can cause different types of esophageal injury. Other than that, we'll be studying about a topic called as acute esophageal necrosis, which is also called as black esophagus. So in the injury with the nasogastric tube, the source of injury causes a stricture formation. As in this picture, you can see that after the removal of the nasogastric tube, the esophagus has a narrowing, which is called as a stricture. This stricture causes a complete blockage sometimes in patients and does not allow food to pass by. Other than that, the mechanism which causes esophageal injury with the use of nasogastric tube is the gastroesophageal reflux disease. There was a study that happened and which taught us that patients which undergo nasogastric tube placement have a very different effect, which causes an increase in the esophageal acid exposure. This occurs because when the nasogastric tube is being placed in the esophagus, it causes the acid pH to lower to less than 4. This was compared with patients without the nasogastric tube placement, and their pH remained above 4. And so it showed us that it causes nasogastric tube placement causes increase in the acid exposure. And if we talk specifically about the strictures, the complication with nasogastric tube placement is that the strictures are very long, narrow, and they're very difficult to manage endoscopically. Other than that, there are different types of non-endoscopic tubes. They're called as respiratory luminal devices, which are being used in the esophagus, which can cause different types of esophageal injury. These include esophageal lacerations with the use of a combi tube. This is a combi tube which is used in the esophagus in a way to resuscitate a patient. This combi tube can cause different types of lacerations within the esophagus. And then a cuffed tracheal tube can also cause a tracheoesophageal fistula. What is a tracheoesophageal fistula? A tracheoesophageal fistula is when the trachea is present and behind it is the esophagus, and a fistula, which is a narrow pathway that occurs between the trachea and the esophagus. We can diagnose that with the help of a symptom. We can diagnose tracheoesophageal fistula is that when the patient swallows any food or any liquid, he starts to cough and he starts to choke. This happens because the food is being transferred from the esophagus into the trachea and into the respiratory canal, which causes the patient to develop a cough. Other than that, there are different types of esophageal perforation that can occur from a thoracostomy tube, which is also called as a chest tube, and with the use of a transesophageal echocardiography probe. As you know, that echocardiography probe is also used from the outside, used on the chest of the patient, and there's another type of probe that is being used within the esophagus. The probe is passed down into the esophagus, and as you can see in this picture, the probe is passed down into the esophagus, and it causes sound waves because the esophagus is present right behind the heart. It causes sound waves that creates pictures of the heart, and we can visualize through a screen the different types, the different parts of the heart. We can visualize the different walls within the heart. Now, if we talk about the acute esophageal necrosis, this is also called as a black esophagus. It occurs because of ischemia and impaired mucosal barrier. The pathogenesis that causes this necrosis within the esophagus is that ischemia occurs. Ischemia is when blood supply to the esophagus is completely shut down. And any sort of impaired mucosal barrier can also cause this necrosis to occur. And the other different types of etiologies or causes that can cause esophageal necrosis is a very severe acid reflux from the stomach, and a virus known as cytomegalovirus, which also causes this sort of esophageal necrosis. So esophageal necrosis is mostly present in patients who are impaired, such as diabetes mellitus, any sort of hematological or solid organ malignancy. These patients might develop acute esophageal necrosis, and patients who are very malnourished, patients who have a very severe renal insufficiency, patients who are cardiovascular compromised, and patients with trauma. Other than that, there are different types of hypercoagulable states that can also cause acute esophageal necrosis, as the artery that supplies the esophagus is being blocked or being coagulated, which causes this necrosis to occur. So in this section, we have studied about the different acute esophageal necrosis, and then we've studied about the different types of injury that can occur with tubes, such as the nasogastric tube, which is being used when a patient is undergoing a surgery, and that there are different types of respiratory luminal devices, such as the combitude tube or the tracheal tube, which is cuffed. And other than that, there are different types of transesophageal echocardiography probe that can cause serious effect and injury to the esophageal mucosa. That's all from this section. Thank you for watching sqadia.com.